Hello. Do you ever ask patients with alopecia areata about diarrhea or about muscle spasms? Well, if you don't, then I believe that after this presentation you'll start doing this. I will talk today about the Satoyoshi syndrome, and I would like to start with telling you the story about an 8-year-old girl who was a patient of mine. And I must say, when I asked the parents whether or not they would agree that I present this case without the name of the patient, the parents were very enthusiastic because they said they were going from doctor to doctor and most of the doctors did not know the syndrome. So this was an 8-year-old girl. At the moment when she visited our department, she started having painful muscle spasms in both legs when she was 4 years old. At the age of 5, she lost all her hair, and she also had, as the patient's parents reported, episodes of diarrhea. Trichoscopy was not really remarkable. There were multiple regularly distributed yellow dots, just as in long-lasting alopecia areata. What was interesting, the patient had positive antinuclear antibodies, and because of this she was diagnosed for lupus, but lupus was excluded after many examinations. However, for me, looking at the hair and at the patient and in the history, it was quite clear for me that the patient fulfills the criteria of Satoyoshi syndrome. Satoyoshi syndrome is a disease of the children. 75% of the patients have onset of the disease when they are below the age of 18, and the average age of onset of the symptoms is approximately at the age of 13. The girls are affected more commonly than the boys. What is remarkable is that the average time from the onset of symptoms until the moment of diagnosis is usually very long. On average, this is 5 years, and this ranges from less than 1 year up to cases which have been described with more than 30 years between the moment of the first symptoms until the moment of the diagnosis. The symptoms, which I will be discussing in a moment in detail, are the hair loss, which is usually very rapid and extensive, leading to alopecia totalis or alopecia universalis, the muscle spasms, the skeletal abnormalities, and diarrhea resulting in malabsorption. The hair loss, as mentioned, is usually very rapid. So the time from the onset of hair loss until the moment when the patient has no hair at all is usually between few weeks up to few months. And rarely we see patients, such as in this image, who have typical alopecia areata patches. In some cases, this is extensive hair thinning with no patches. But what is remarkable that the patients who develop alopecia totalis or alopecia universalis, these are usually patients who are antinuclear antibody positive. The extensive hair thinning with no patches is usually present in patients who are anti-nuclear antibody negative. Our experience shows that trichoscopy of Satoyoshi syndrome is not distinguishable from alopecia areata, and especially if this is a patient with alopecia totalis or alopecia universalis where there is no hair and you cannot evaluate the hair shafts. In such cases, you will just have a field of view full of yellow dots. Also, histology in most cases is consistent with alopecia areata. Few words about the muscle spasms. They usually last from half a minute up to a few minutes, and they tend to repeat themselves multiple times a day. And aside of the pain which is associated with this muscle spasm, they make the life of the patient very difficult, especially if they are at school or at work. Usually the muscle spasms start with the legs and then they may progress to other parts of the body, but basically they may be present or may be associated with any muscle or muscle group. These muscle spasms may be triggered by some factors such as exposure to cold, by mechanical injury, by exercise, or by emotional stress. In most cases, they will develop with no apparent cause. There are some literature data which show that these muscle spasms may improve after bed rest or with moving slowly, because this would not trigger the muscle spasm. Some patients, especially children, may develop contractures, and they are believed to be the effect of the muscle spasms, the repeated muscle spasm, which lead to a reduced mobility of the upper and lower limbs. Especially this may be important at the stage when the child is growing. Antinuclear antibodies are not present in every patient with Satoyoshi syndrome, but they are present in the majority of cases. There is no specific subtype of antinuclear antibody which would be associated with the disease. In some patients it was Rho or La or the dsDNA, but in the majority of patients the immunoblot will be negative. The antinuclear antibody positive Satoyoshi syndrome has some unique features, and this is the fact that usually the patients are slightly older, so older children, adolescents, and adults. Very often it leads to alopecia totalis or alopecia universalis, and the good element is that usually it responds quite well to treatment, especially to the glucocorticosteroids. A few years ago, we have established the criteria for the diagnosis of Satoyoshi syndrome, and the obligatory criterion, the most important criterion, is alopecia totalis or a very severe hair loss. There are additional criteria, 3 of them. First, the muscle spasms, second, diarrhea, and third, the positive antinuclear antibodies, and the patient has to fulfill at least 2 of these 3 additional criteria to make the diagnosis of Satoyoshi syndrome. An important problem of the Satoyoshi syndrome is the late diagnosis and the very late start of therapy, and in many cases the patients are being treated independently by the neurologist for the muscle spasms, by the gastroenterologist for the diarrhea, sometimes by the endocrinologist for the amenorrhea, occasionally by the dermatologist, but sometimes the dermatologist is not even seeing the patient because the many symptoms are considered more important than the hair. But again, this is an example where the hair loss may be the first symptom of a severe disease, and it may lead to the diagnosis, and also it shows how much medical knowledge is required to be a good hair expert. The response to therapy differs from case to case. It is generally better in patients who are antinuclear antibody positive and tends to be not so good in patients who are antinuclear antibody negative. The mainstay of the therapy is the administration of glucocorticosteroids, either orally or intravenously, and in some cases we may consider intralesional triamcinolone in the case of alopecia. The adjuvant therapies include the intravenous immunoglobulins, but also immunosuppressive drugs such as methotrexate, cyclosporine, or azathioprine, and other immunosuppressive agents. We may also address the problem of the muscle spasms. These drugs will not affect the course of the disease, but they may decrease the intensity and the frequency of the muscle spasms. My conclusion from this presentation is also a title of one of our articles, which says alopecia areata, how not to miss Satoyoshi syndrome. And in my opinion, every patient with alopecia areata, especially with severe alopecia areata, should be tested for antinuclear antibodies and ask for muscle spasms or diarrhea. And if you would like to hear more about hair or about trichoscopy, please consider taking a look at my YouTube channel. Thank you very much.